The term mommy makeover is widely used but is often misunderstood. It is not a single operation, it is not a standardized package, and it is certainly not about chasing perfection. A mommy makeover is a customized surgical plan designed to address the predictable structural and aesthetic changes that occur after pregnancy. Pregnancy stretches the abdominal wall. It can separate the abdominal muscles, a condition called diastasis recti. It stretches the skin, it redistributes the fat to the flanks, hips, and lower abdomen. It often changes the breasts, causing deflation, loss of upper pole fullness, sagging, or asymmetry. Diet and exercise are essential for overall health, but there are certain anatomical changes that cannot be reversed with exercise alone. This is where surgical restoration may be appropriate. So what is typically included in a mommy makeover? Most commonly, it includes three components. First, abdominoplasty or tummy tuck. Second, breast surgery, which may involve a lift, augmentation, or both. Third, liposuction for contour refinement. Let's break these down individually. Abdominoplasty addresses two critical issues: muscle separation and excess skin. After pregnancy, the abdominal muscles often stretch apart. When this occurs, the abdominal wall loses structural integrity. Patients frequently describe looking pregnant again, even when they are thin. This is not a fat problem, it's a structural one. During a properly performed tummy tuck, the abdominal muscles are brought back together, restoring core stability and flattening the profile. Excess lower abdominal skin is removed. In many cases, stretch marks below the belly button are eliminated because that portion of skin is excised. The second component is breast surgery. Pregnancy and breastfeeding can significantly alter breast volume and proportion and position. Some women experience deflation and loss of upper fullness. Others experience sagging where the nipple descends below the natural fold of the breast. Depending on the anatomy, the solution may be a breast lift alone to reposition and reshape, an implant alone to restore volume, or a lift combined with an implant for both elevation and fullness. This decision is highly individualized and based on tissue quality, skin elasticity, and desired outcome. The third component is liposuction. Even with weight loss, many women notice persistent fat along the waistline, flanks, or hips. Strategic liposuction enhances overall proportion and restores a more defined waist. Now, an important question: who is the ideal candidate? The best candidates share several characteristics. They are finished having children. Future pregnancies can reverse surgical improvements, so we don't want that. They are at a stable weight. Surgery is not a substitute for weight loss. They are in good overall health without uncontrolled medical conditions. They understand that recovery requires planning and support, and they have realistic expectations. A mommy makeover is not about returning to your 20-year-old body. It's about restoring structure and proportion after pregnancy altered it. It can also be done after massive weight loss as well. Let's talk about recovery, because this is often underestimated. When procedures are combined, recovery must be approached thoughtfully. The first week typically involves significant rest. You will need help at home, especially if you have small children. Lifting restrictions are strict, usually no lifting more than 10 to 15 pounds initially. Light walking begins immediately to promote circulation and reduce risk of blood clots. Most patients return to desk work within 2 to 3 weeks, depending on the extent of surgery. Swelling improves gradually over several months. Final contour refinement can take time. Patience is very important. Another common concern is safety. Combining procedures can be safe if done on properly selected patients. In fact, for many, it is most efficient to undergo one anesthesia event and one recovery period rather than staging multiple surgeries. However, operative time must be carefully managed. Patient health, BMI, and medical history are critical considerations. This is why thorough consultation and preoperative evaluation are essential. Let's also discuss limitations. A mommy makeover does not prevent aging. It does not make someone immune to future weight gain. It does not replace lifestyle habits. Long-term results are maintained through stable weight, regular exercise, balanced nutrition, and avoiding future pregnancies. The most satisfying outcomes occur when surgery enhances what you have already worked hard to achieve. There's also an emotional component worth discussing. Motherhood is transformative. Many women prioritize their families for years and place their own physical concerns last. Choosing surgery is not about vanity. For many, it is about reclaiming confidence and restoring balance. When performed conservatively and thoughtfully, results should look natural, not exaggerated. Proportion matters. Harmony matters. Individualization matters. A mommy makeover should never be a prepackaged set of procedures applied universally. It should be customized, carefully planned, and performed with attention to both safety and aesthetic balance. The goal is not to look operated, the goal is to look restored. If you are considering this procedure, the most important step is an honest, detailed consultation where anatomy, goals, lifestyle, and safety are evaluated comprehensively. Because when the right candidate undergoes the right combination of procedures, the transformation is not just physical, it's structural and often profoundly empowering. So go to our website or call our office and please make an appointment.